Welcome to Sonata Insights Live. I'm Tara Murphy, Senior Director of Global Marketing and Advocacy. Sonata Insights Live is a program meant to spark conversation about fibroids, including the symptoms and treatment option of fibroids. During these episodes, you hear from guest physicians, patients, and advocates as they share their stories to educate our audience. I'm very excited to have a physician and patient here with us today. Dr. Mala Freeman-Kwaku is the lead physician at Arboretum Gynecology. She attended the University of Virginia in Charlottesville, both for undergraduate education and medical school, where she received a full scholarship with the Robert Wood Johnson Foundation. Her internship and residency were at Georgetown University Medical Center in Washington, D.C. Dr. Freeman has practiced medicine for 22 years, providing obstetric and gynecologic care for the women of Charlotte, North Carolina area. She has a special interest in the treatment of symptomatic uterine fibroids, heavy bleeding, and menopausal symptoms, and is skilled in hysteroscopy, office procedures, and the Sonata procedure. She is also a physician consultant for us, speaking to peers and patients. She has kept up her obstetric skills with services offered through her private company, MFK Advising Group, where she also provides speaker opportunities and expert witness work. She's married to Dr. Hans Kwaku and is the proud mother of 4 young people. She is active in her church and enjoys traveling the U.S. and around the world. Welcome, Dr. Freeman.
Thank you so much, Tara. It's a pleasure to be here.
And we also have with us Uniqua Brown. Welcome, Uniqua.
Thank you.
So from what I see here, you are 43 years old, working in the chemical engineering field, married with a 6-year-old son, and you're passionate about exploring new places, watching great movies, and getting some quality sleep, which I can appreciate for sure. And as many women, you're always balancing work with family and love the occasional adventure. So we are very happy to have you here to talk to other women about your experience today too.
Thank you for having me.
Of course. So we're going to start with the basics. It's basically some time for girl talk between the 3 of us here today, which is always fun for us, Dr. Freeman. So really wanted to start from the beginning. So if you could talk a little bit about what are fibroids and just share with the audience a little bit about what they actually are.
So fibroids are smooth muscle tumors that come from the uterine tissue, because we know our uterus is actually made of smooth muscle. That's how that's why it's so powerful and can, expel a baby, because it's, a very strong muscle. And sometimes those muscle fibers go through changes that cause them to grow into these smooth muscle tumors. And that's basically what fibroids are. They're, the majority of the time, almost 100% of the time, not cancerous, but they do kind of grow like a cancer would, in that they just continue to proliferate and enlarge in size.
And how do you know, or how would you diagnose a woman with fibroids?
Usually fibroids are diagnosed on physical exam, usually your annual exam, either because the patient is just coming in for a routine exam and we're performing a pelvic exam, which is, different from the pap smear. A pelvic exam, which is usually where we would use both of our hands, maybe 2 fingers within the vagina, and using it to compress the uterus between our fingers and our hand to feel the size of the uterus. I do that on every patient that comes in for a pelvic exam for a visit, just to see. A lot of times it may be at an unexpected visit when a patient complains of heavy bleeding, bloating, bulk symptoms such as just feeling like their abdomen is getting large, problems with constipation or frequent urination. Those are the kinds of symptoms that usually cue us that the patient may have fibroids.
So Uniqua, let's talk a little bit about the beginning of your fibroid journey. So how did you find out that you had fibroids? Were you having symptoms, or did something prompt you to go in to see Dr. Freeman?
So I did not have any symptoms initially. I found out I had fibroids during an ultrasound when I was pregnant. So they identified 2 small fibroids at that time. and I had no symptoms until a couple years after I had my son.
Okay. And Dr. Freeman, when you see a patient that's pregnant and you see the fibroid in there, is it generally that you would just kind of let the fibroid go and see what happens after delivery, or?
Yeah. So there's no way to really intervene, or we should not intervene when someone is pregnant and has fibroids unless they have a problem. Very rarely there may be a case where there's a large fibroid that may be on a stalk, or what we call pedunculated. And sometimes those can torse or twist during pregnancy and cause a lot of pain because they're not actually embedded in the uterine wall. You can perform surgery to remove those, especially if they're causing pain, or very rarely they may become necrotic because they lose their blood supply, and that can cause a pelvic infection or other problems such as preterm labor. But it's very rare to ever have to do surgery when someone is pregnant, and you really shouldn't do surgery on fibroids when one is pregnant.
And how long after you had your son did you start to experience symptoms?
I would say probably about maybe 2 years after I had him is when I started getting symptoms, and those symptoms included some heavier cramping during my cycles and heavy bleeding as well, which I've never had.
So heavy cramping, heavy bleeding, you said some other symptoms were bloating, constipation. What other things can a woman look for as a symptom, Dr. Freeman?
Constipation, bloating, a frequent urination, or not being able to hold, a normal amount of urine. Sometimes women have pain during sexual activity, depending on the position of the fibroids. They can just have pain in general, where, even anytime throughout the month, they're having aching in the pelvis. Sometimes that can occur when the fibroids either degenerate, or if they're on a stalk, they can sort of move around or twist. I've had that happen very commonly.
And Uniqua, when you started to have your symptoms, did you go to the doctor right away? We hear very often that you wait quite a while, you kind of suffer through it because you just kind of deal with it because you're busy taking care of everybody else. But how long did you wait before you went in?
I would say I probably waited about 2 years or so. And not because I didn't have the time, it was more so not realizing that it was this big change. So initially the symptoms, it was noticeable, but it was not too questionable. And then gradually, as those 2 years went by, I noticed more and more that the symptoms were not lessening, but becoming more aggressive.
Okay. And so you went in to see Dr. Freeman.
Yes, and I mentioned the heavy bleeding, which to me was more of an issue than the cramping. Prior to having the fibroids, during my cycle was very light and would last probably about 2 days, 2.5 days or so. When I went to Dr. Freeman to discuss what I was experiencing, my symptoms had progressed to heavy bleeding, probably going through a full pad in about an hour or two, which wasn't normal for me because previously I could wear a pad all day and have nowhere near what I've experienced. So that to me was the most concerning.
And Dr. Freeman, when we talk about a heavy flow, a normal flow, what would be considered normal?
I'm listening to Unique's story, and it is very classic. A lot of times we tend to, as women, sort of not even really pay attention. Something just seems normal, and then gradually over time, it just becomes more and more annoying. And then you kind of pause and you go, wait a minute. I'm like changing this pad or I cannot leave my home without a whole suitcase full of pads. I have a little visual here, so I don't want to traumatize anybody who has heavy menstrual bleeding. This is betadine that I have used. So don't think this is blood, but I looked it up, and this is a pad, which, you know, everybody's familiar with these pads that go to the front and the back. This is actually the amount of blood that you should have for your entire period. Surprising. It's 3 tablespoons. And I think the average woman would say that's nonsense, because, you know, most women have more bleeding than that. And I think they probably need to update their information because, I mean, this is what they call normal. And I put all of it on this one pad, and you can see in your cycle, which is 2 days to 5 days or 7 days, whatever it is, this is all you're supposed to have. And so if you're having this pad full, or you're changing a thicker pad, we don't have the big jumbo ones in the office because we try to keep that down, that kind of bleeding to a minimum around here. But these thick pads, and you're filling that up every hour, or you're passing clots anywhere from the size of a quarter to a grape or a plum, or, you know, even larger. Women come in and they try to show me these pictures, and I'm like, I got it. I know what a clot looks like. But when you're passing clots and you're filling up pads every 1 or 2 hours, like she was saying, that's not normal. It's not heavy. And, you know, if you're taking home something so that when you sleep at night, you got to put this in the bed because you're going to have an accident, that is your sign that the amount of bleeding that you're having is not normal.
That is a very powerful visual, because I hear the numbers, you know, working with and for Sonata, but seeing it like that, I mean, that's not a lot at all. And so that's really, I love that you did that. You surprised me with your prop, and I love it.
So you can imagine if you're supposed to have this much in 5 days, and you're changing a pad every couple hours, even 2 or 3 days of your cycle, that is completely disruptive to your lifestyle.
Absolutely. We hear a lot, and I think we've heard a lot at patient events that we've done together and things like that, that women tend to see other women in their family that are changing their clothes, laying that pad down on their bed so they're not ruining their sheets at night, going through those pads time and time again. And so it starts to kind of, to them, it seems like it's something that is just normal, or what you're going to deal with as a woman that's going through her cycle every month. And so I think it's really important for these conversations like this to be able to make sure that you all are educating them on, you know, that's not normal. Even if you've seen the cycle continue to happen in your family, that might not be what it's actually supposed to be that we're putting out there. And, you know, how common is it that if, you know, your mom had fibroids, or your grandma, or your aunt, that you yourself are likely to have fibroids?
Yes, there's definitely a genetic component to it. And a lot of times when I find fibroids in a young woman, or women of different ages, they usually say, oh yeah, my mom had that, and my aunt had that. And I have, you know, patients where they have maybe one or more sisters, and either they've had them, and then they say, oh, and then the 2 of them had their uterus, you know, removed. They had a hysterectomy, and then my mom had a hysterectomy. So they almost kind of, especially when they know they have fibroids, they almost kind of expect that that's what's going to happen. But it's very, very common, very, very common. And in fact, usually if your mother or your sister has fibroids, you probably have a pretty good chance of having them too. They may not be symptomatic or need any monitoring or management, but probably do as well, because that's how strong the genetic component is.
Do you know, Uniqua, was it something that you've seen in family and kind of just thought it was something that happened in your life, or was it kind of triggering when you started to see the bleeding getting heavier and heavier because it wasn't something you were familiar with?
It was not something that I was familiar with. And I think having my son so late, most of my adult life, I was on birth control. So it never really, it didn't really trigger me until I had him. And then I had stopped the birth control, and then my cycle. So I didn't know if it was an effect of the fibroids or not being on birth control any longer that was changing my body and how it was reacting to just being free of birth control. But it did become alarming to a point where I had to figure out what to do next.
Dr. Freeman, is it common if you have fibroid that it could cause no symptoms for a while and then all of a sudden starts acting
Yeah,
up?
that's very common. And in fact, some fibroids, for whatever reason, they can grow very insidiously where, they start off small. You may not really feel them over time. They may get larger. But I've had, situations where, doing a pelvic on a person or in a patient, and you do it for several years and you don't feel anything. And then all of a sudden, you feel something that you didn't feel before. And that's rare, but it happens. And it's always really odd when that happens because sometimes they do grow very fast.
Wow. So let's talk a little bit about treatment options. There's a whole range of treatment options out there. Can you talk a little bit about kind of least to most invasive and then unique? Well, we'll talk about a little bit about how you navigated to Sonata after we hear about the treatment options.
If I could put a graph up, it would probably have all kinds of, lines going everywhere. Having seen women with fibroids for the past 22, almost 23 years, they present in so many different ways. They can be in so many different locations. They can cause many different kinds of symptoms. And depending on those symptoms or where they are, it kind of helps us gauge where we should start treatment. I mean, treatment can start anywhere from just treatment can start anywhere from just a light birth control pill Uniqua was on, and a lot of young women may have heavy bleeding that's not due to fibroids, or they just may have small fibroids that they don't know are there. And when they're starting on birth control pills over their young reproductive life, they may not be aware that that's what's happening until they stop. So we can do anything from just starting with some birth control pills. There are long-acting reversible contraceptives that can be very helpful to control bleeding. There are medicines that you can take only when you have a period that help lighten up the cycle while you have it. There are medicines that can block your own estrogen, which is what the female hormone that your body produces that help the fibroids grow. There are radiologic procedures that can block or occlude the blood supply to the fibroids. Obviously, removing the fibroid either through the vagina, hysteroscopically. And my other little diagram here that I keep in the room, which has been very handy, is something that I found in a magazine. And it basically talks about the different areas of fibroids, because there's all locations from right inside the cavity, which are like type 0, to some that may be even dangling out here on a stalk, if you can see that pretty well.
Yes.
But I love this diagram because when I show this to patients, it helps them understand like where I feel their fibroids may be, or what kind of diagnostics we need to do to find out where they are to see what would be the best option.
Because you can't necessarily do all treatments on all fibroids.
No. And some treatments will be helpful. There are some patients who, for instance, they may have very large fibroids, but they don't have any bleeding at all. And the fibroid may be very distal or far away from the lining of the uterus. And then there's some fibroids that can be very tiny, but be right near the cavity and cause the worst kind of bleeding ever. So as your other physician said, and I always say to my patients too, is location, location, location. You can have the teeniest thing and cause a myriad of problems, or you can have the largest and the patient is completely unbothered, except, people asking her, when is your baby coming? And she's like, I'm not pregnant. Yeah.
One thing that we hear a lot that I would love for you to speak to is when patients are on medical management, since it's bringing the symptoms down of what they're experiencing, a lot of times the women think that it's actually treating their fibroid. Can you talk just a little bit about what's actually happening?
Yeah, I mean, there are medical there's medical management that can be helpful with not only the preventing the fibroid from growing. Usually something you take orally is probably not going to stop the fibroid from to make it shrink. There's injections that we can use that can block the estrogen that can cause the fibroids to not continue to grow. But usually once you stop some of those treatments, the fibroids will then go on and continue growing, and then the symptoms will come back. Sometimes those treatments are great for bridging a patient between, stopping their symptoms while you wait for them to store up their own blood if they're very anemic, or if they just need a little bit of time until they can get to the next stage where, they can have something done, but they just really need some relief from the heavy bleeding. So most of those types of medical treatments, I tell them, are temporary, and they can also bridge someone who says, I'm 52 and I should be in menopause soon. They really just don't want much done. You can always use those interventions to bridge them until they get to menopause.
And you could do blood tests to see how far it is from menopause, or no, it's just kind of.
I'm sorry, say one time.
And you could do blood tests or testing to see how far away a woman is from menopause, or for that bridge, or
it's kind of hard because usually we go by their symptoms. A lot of times it's the menstrual cycles start to space out. Sometimes they become closer and then they just boom, stop. So that you can have a myriad of different presentations with perimenopause or that before menopause. The blood work's not so accurate because, one thing that signals that time before menopause is that your estrogen levels can really fluctuate. And so sometimes you can check them and they'll be completely normal, but you're having hot flashes and your periods are not coming regularly. So a lot of times we, as physicians and gynecologists, we usually go by the clinical symptoms, which is more of, how are your periods spacing, or the quality of the bleeding, that sort of thing, because the lab tests can be really unreliable.
So what we're learning a lot from you today is cycle can tell a lot about what's in your body between fibroids, regular flow, going into menopause. So that's all very good information. Uniqua, so you were diagnosed with fibroids. You saw Dr. Freeman. She tells you have fibroids. How did you get to the point of deciding what treatment was going to be right for you?
So when I had the ultrasound to confirm the number of fibroids and, the size of the fibroids, Dr. Freeman did tell me that I would be a good candidate for Sonata. So I just say, yeah, let's do it. Let's see what happens.
Because you know her and trust her. So you were like, let's rock.
Mm-hmm. Yeah.
Dr. Freeman, how do you explain what Sonata is to your patients?
I let them know that, especially if they're really good candidates for it, because obviously whenever we have a talk about fibroids, we want to there's so many different possibilities. You could be in there talking for an hour on from 1 to 20 on different things, but not everyone is a good candidate for everything. Obviously, a lot of women that are in their late 40s, they don't want to start on a pill, or maybe they don't want an intrauterine device. Maybe they're not candidates for those sorts of things, or maybe their fibroids won't respond. So if they're good candidates for Sonata, for instance, they don't want surgery, or the location of their fibroids are such that I feel that they would respond very well to the technology, I just let them know that there's a technique out where we can go through the vagina, through the cervix with an ultrasound probe that's, does a very close ultrasound and finds where the fibroids are located. And with that, we use electrodes that go through the actual device that protrude through the fibroid and produce heat, which causes the blood supply of the fibroid to be I don't want to use the word killed off, but to be ablated is what we really say. And it causes the fibroid to shrink over time, therefore decreasing the amount of bleeding the patient will have.
And Uniqua, so whenever, a little bit about when you got Sonata, what that kind of day looked like when you went into the office and how it played out. Like you went in and how long did it take and how were you feeling?
So that is kind of a loaded question because I had 2 procedures done at once. I went in, I scheduled tubal ligation and the fibroid removal. So I think I got to the hospital at about 7 a.m. Of course, prep time takes a couple hours. So I might have went back into surgery around 10-ish. And I feel like I mean, obviously I wasn't awake, but it seemed pretty quick.
Mm-hmm.
And once I was in the recovery room, I did not feel any type of pain. I didn't feel, prior to having the surgery, we talked about what recovery time would look like with me having the 2 procedures. And Dr. Freeman said, you may be down a day or 2 or what have you. But when I got home, I was fine. I walked fine. I was going to the bathroom fine. I did not have any pain. She did prescribe me some pain meds just in case I did not need any pain meds. So I felt really good.
That's awesome. That makes me happy. Dr. Freeman, whenever you are doing just a Sonata on a patient, what does the normal time look like for average for a procedure to get Sonata? And what are you hearing from your patients about recovery?
It varies per patient because obviously we're using the device to ablate each fibroid that is eligible to be treated. So depending on the size of the fibroid, the location of the fibroid, how many times we need to ablate each fibroid, or maybe if there's only one fibroid, it may be a 20-minute procedure. If there are 5 fibroids that you have to ablate twice each or 3 times, for certain ones, it can be an hour or more. But I would say in general, it takes probably about 45 minutes between going to the operating room, preparing the patient, surveying the uterus, finding the eligible fibroids, and doing the ablation. And then that's about it. Usually following the surgery, I let the patients know that they may have, cramping, but they won't need anything stronger than ibuprofen. And I don't write prescriptions for folks for Sonata, and I haven't had anyone call me back for pain medicine. But tell them that they'll probably have some bleeding for the several days after the procedure. And then as the fibroid begins to respond to the treatment, they may have some sloughing of tissue or brownish discharge that comes along with that.
Niqua, did you have any of that, the discharge?
No, I don't recall that. I just had, it was light bleeding.
Mm-hmm.
And it lasted maybe like a day or 2.
Mm-hmm.
And then that was pretty much it.
And all of your patients, Dr. Freeman, when you're doing Sonata, if they're just getting Sonata, go home same day?
Mm-hmm. Oh, yes.
And what do you hear in general from them about their recovery time when they're getting back to normal activity from
Yeah, I usually tell them, I mean, every outpatient surgery has its own little window of time, of expectation that we feel the patient's going to need. I don't say that, oh, you should be fine to go back to work tomorrow. I usually say, you might want to take tomorrow off, but the day after that, you should be fine. And so I think, because a lot of patients are now working from home, they just go back next day. But I don't have, I've not had anyone call me back for anything for pain or feel like they needed to be out of work longer than the day or 2 that, actually the day of surgery and the day after surgery maybe. So that's really reassuring to me.
Absolutely. Well, when did you get your procedure? How long?
This was, I think this made a year, or was it maybe 2 years?
October of 20.
It was 24. So we initially scheduled it for 23, and something, there was some miscommunication with my insurance. So we rescheduled it for the following year. And then, so yeah, it was late last winter. Well, no, 23.
It's been over a year. When you came back, it had been a year.
So it was in 2023.
Okay.
Yeah.
And
so it's
how
been
have you
a little
felt
over a year.
since? How have you felt since? So it's a little over a year. And how are you feeling today?
I feel good. I don't have any of the previous symptoms that I had prior to having the surgery. My cycles are back to normal, very light, 2.5 days at most. And I feel like I felt prior to getting pregnant with my son.
Very nice. Very nice. And Dr. Freeman, we know a lot of times when women have fibroids, they could get more fibroids. Is Sonata something that you can use if new fibroids would come?
You can definitely do the procedure more than once. I think the idea is that I feel like people fall in two categories. They're either women who, or my patients anyway, they're either women in their mid-40s who are probably going to have most of the fibroids that they're going to get, / when we treat the ones that are problematic, they're probably not going to have new problems occur. But if they did, we can always go back and treat it again. Or there may be younger women who haven't had children yet, who may have fibroids and are now just becoming symptomatic, and they don't want to allow the fibroids to continue to grow.
Yep. Okay. And sorry, my cough is coming on quickly here. So they can get it again if new fibroids come, and no issues with that happening, which is good news. Uniqua, have you been checked for more fibroids again, or you're good to go right now? Your symptoms?
No, I think I'm good to go. I haven't had a reason to want to check. I feel good. Like I said, my symptoms are gone from previous, so I think we're good to go for now. Fingers crossed.
Yes, for sure. I would love just to give you both, a minute to give your advice to women. I think it's really powerful to be able to be brave enough as a patient to share your story to help other women. So Uniqua, we thank you for that. And I just want to give you a second if you want to give women advice, if they were in your shoes, and just what your patient journey has been as a woman that is living with and treated from fibroids. And then Dr. Freeman, the same, just kind of your physician advice to women as well.
My advice would be just to talk openly about it. You would be surprised at how many other women are experiencing similar symptoms or have some of the same stories that you may have. So it's good to share information and get some feedback on, what you can do, who you can talk to, and make sure you consult with your doctor and let them know what you're going through as well.
Thank you. Dr. Freeman?
I would just say that sometimes we don't know what's normal or not. Just like Uniqua said, it's important to share information, and that's really key for women to share information about their bodies and what they feel is normal or not. Definitely see your doctor every year, and I really encourage my lady patients, or all my patients are ladies, but I encourage my patients to, see me every year as their gynecologist, and they can see their internist as well, because we really do focus on different areas. And I am particularly interested, especially at this stage of life, that anything that affects your well-being or anything that keeps you from living your best life, it really shouldn't be due to your menstrual cycle. I mean, it is a natural process and we have to embrace it, but there are, times when there are abnormalities, and a normal cycle should be something that no one's begging for, but it shouldn't be a nuisance. And so if you notice something that's different or something has changed over time, that's really important to bring it to our attention, because that's what we're here for, is to really help you sort of get through those problematic times.
And I think it's so important that women have access to physicians like you that are willing to hear their story, willing to hear what's changing in their health and in their cycles and everything that's happening. And so to be able to, for all of you out there, to be able to find Dr. Freeman or other physicians like her that are across the country that, like to talk to women about all of their treatment options that are available, including the Sonata Treatment. You can visit sonatatreatment.com, and there's a physician locator on there that could navigate you to schedule a consultation with Dr. Freeman or other physicians around the country. And we also have a nurse advocate, Teresa, who is able to be found on our website as well, and she could help to get you to Dr. Freeman or other physicians across the country. So thank you both for sharing information, stories to empower other women to be able to take care of themselves and understand their health and their bodies and all of the things that are important to us. And we really appreciate you taking the time to be with us today.
Thank you for giving us this platform.
Thanks for having us.
Thank you.